Today, Mike. So let me start by a little review of OrthoIllinois and McHenry. Since you're new to McHenry, Jeff, and for the people that will see this on recording, OrthoIllinois opened up a clinic a year ago in September in McHenry. So it's past our 1-year anniversary, and Dr. Kannan started with us back a year ago when our clinic in McHenry opened. So we are on the corner of Shamrock Lane and Route 31. Very easy to find. There's a little strip mall back there. You don't really see signage from the street, but there's a little strip mall back there. I believe a nice little Italian restaurant that I've not tried out yet, but eventually will. So yeah, we've been there a year. And in addition to Dr. Kannan, there's another specialist that sees patients in McHenry. His name is Dr. Don Daniels. He's a total joint replacement orthopedic surgeon who does the minimal invasive joint replacement. And actually, some of his patients are going home the same day after surgery, which to me, I've been in this business for over 30 years, and I still find that absolutely incredible that somebody can have a joint replacement and go home the same day. I'm baffled by that, but if doctors now, and Dr. Kannan will speak to this, are not up to date on the newest procedures and technology, that's what people are looking for. They're doing their homework now. The people are really online and trying to find out who the best physicians in the area are, and we're very proud to have Dr. Kannan on our staff and speaking to you today. One other note about our clinic in McHenry, we have a walk-in orthopedic injury clinic that's open Monday through Friday, 8 a.m. to 8 p.m. and on Saturday, 10 to 4. So we're treating we don't treat colds, we don't treat the flu or COVID. We treat sports injuries, work injuries, anything that, sprains, strains, back, neck, shoulder, all that good stuff, concussions, lacerations, fractures, things like that. So we have x-ray cast room on site. No offense to hospitals in the area or urgent care, but if you're having ortho injuries, you don't need to sit in an ER. You can come see us. Again, 8 to 8 Monday through Friday, and to 4 on Saturday. Please check that out on our website, and also we have that information will be going out on Monday through the chamber. All right, now let's get to the feature of our presentation today. I'm very, very proud to introduce Dr. Jacqueline Kannan. Again, has been here for a year. She is a board certified rheumatologist and did her fellowship in rheumatology, and for your information to become a physician, which again, this is another thing that baffles me. I don't know how you did it, Dr. Kannan, but we're talking college, medical school for 4 years, residency for 4 years, and then on top of that, Dr. Kannan did a fellowship at the University of Illinois Hospital in Chicago for 2 years to become a specialist in rheumatology. So I'm always really impressed with credentials like that. The fact that she went through that much training and that much schooling to be a physician to help others. So it is absolutely my pleasure to introduce Dr. Kannan.
All right. Hi, everyone. Thank you so much for inviting me to give this talk. Let me start sharing my screen. Okay, I just want to double check that you all can see my screen.
Yep.
Okay. All right. So my talk today is going to be all about arthritis. And like Paul said, I practice with OrthoIllinois and McHenry and Elgin as well. So what I hope people gain from this talk is what rheumatologists do and what we treat, and a little bit about how we treat the diseases as well. I have no disclosures. So what is rheumatology? It's a study of autoimmune diseases, arthritis, and other disorders of joints, muscles, and ligaments. It is a, rheumatic diseases can be very complex and hard to diagnose often. Rheumatologists are experts at putting together pieces of a puzzle to adequately diagnose and treat patients with rheumatic disease. Why go to a rheumatologist? So we treat a lot of rare diseases that are often difficult to diagnose, and it sometimes does take years, months to kind of figure out what exactly is going on. We have to act as detectives to help put together the pieces of the puzzle of the symptoms people are having and certain lab tests as well. Often if there's no cause for an organ that's damaged or having failure of some kind, then sometimes a rheumatology evaluation can be helpful. So again, why you should go see someone, a rheumatologist, is because that early diagnosis can help patients avoid waiting months to years before getting the diagnosis, one. And once we get you on treatment, the goal is to prevent any further damage from happening or prevent any damage from occurring in the first place. So speaking to your primary care doctor is really important so that patients can have early rheumatology evaluation to prevent that damage. Joint pain and swelling can be due to an autoimmune process and is often very treatable. The same holds true for certain types of muscle weakness and pain, depending on the cause of that. And again, like I said, early diagnosis and treatment of arthritis leads to better outcomes, especially when it has an autoimmune or antibody component to it. So how do we treat or evaluate patients as a rheumatologist? So we always like to get a good history from the patient of their symptoms and a good physical exam. So we like to do kind of a head to toe exam when you come to see us in the office. We evaluate the overall function, including physical, mental well-being, and level of independence. We often order a good amount of imaging and lab testing to help confirm the diagnosis. And then we start the treatment based on all the above factors. And this often involves discussions with the patient to ensure that the treatment that we are recommending would be compatible with their lifestyle. So what is an example, or what are some examples of commonly treated rheumatic diseases? So rheumatoid arthritis is probably one of the most common that we see. Lupus is another one. There's an umbrella category called seronegative spondyloarthropathy, which is a very long name, but it basically encompasses different arthritises such as psoriatic arthritis, ankylosing spondylitis, and inflammatory bowel disease related arthritis. So Crohn's disease or ulcerative colitis can also be associated with an autoimmune arthritis. So we do see osteoarthritis as well, and then gout and pseudo-gout, and then the more uncommon ones, which is vasculitis, meaning inflammation in different blood vessels, myositis, which is muscle weakness due to an autoimmune disease, uveitis, which is inflammation in the eyes, and then some very other rare ones like scleroderma, which causes fibrosis of the skin and other organs, and then polymyalgia rheumatica, where you can get achy shoulders and hips, again, related to an autoimmune component, and then osteoporosis as well. So what is arthritis? So the term arthro means joint and itis means inflammation. There's more than 100 types of arthritis that are currently out there, and it can be infectious, autoimmune, osteoarthritis, and then metabolic, so things like gout. More than 50 million adults and over 300,000 children can actually also get some type of arthritis throughout their lifetime. So a big thing with rheumatology is osteoarthritis versus inflammatory arthritis. So osteoarthritis is the most common type of arthritis that people can get. It's also called degenerative arthritis. And this commonly happens with aging. It's classically referred to as the wear and tear type of arthritis. And you can see in this image what a normal joint looks like. And then there's osteoarthritis, which you can kind of see that joint space narrowing between the bones, and you can see that the bones are kind of rubbing together. The cartilage around the bones has also been thinned out. And then there's the other type of arthritis that we look for commonly in as a rheumatologist, and that's inflammatory arthritis. So an example of that would be rheumatoid, and that's the image furthest on the right there. And that is basically you'll see the inflammation within the joint. So you can kind of see that redness is depicting the inflammation within the joint capsule. And then it can also, that inflammation, when it's there for a long time, it can kind of eat away at the bone and cause an erosion, is what we call, and that's irreversible damage that we would want to be preventing. So again, this is just some more pictures of what we look for as rheumatologists. So the picture on the left-hand side is consistent with osteoarthritis, and you can see those kind of nodules on the tips of the fingers, and then the middle finger joint as well, which again is consistent with osteoarthritis, versus the picture on the right side, which is more consistent with rheumatoid arthritis. And you can see that puffy swelling over the knuckles there too. So that's, again, that kind of hallmark of inflammatory arthritis, is the inflammation or kind of sponginess that we can feel during our exam. So again, going back to osteoarthritis, it's a wear and tear process. It has a lot of causes, but essentially that cartilage gets worn down. And so a lot of times we can use corticosteroids, cortisone injections into the joints. We, in things like the knee, we can do synthetic cartilage or the gel injections that people may have. But often, sometimes a joint replacement is inevitable. And that's when our orthopedic friends come in. Great evaluation for that. So one big thing about osteoarthritis is that weight loss will do nothing for my pain, and exercise will only make my pain worse. But the actual truth of that is that diseases like osteoarthritis can actually be improved with weight loss. So they say, an extra pound feels like 4 extra pounds on the knees. So weight loss of 10 to 15 pounds can actually make a huge difference in how people feel when they have osteoarthritis of the knee or the hip. That brings me to the next topic, which is rheumatoid arthritis. And just a little background on rheumatoid arthritis. So it's caused by antibodies which target the lining of the joints. So again, rheumatoid arthritis is an autoimmune process, meaning your immune system, for whatever reason, has become overactive or hyperactive, and it starts attacking your own body instead of something foreign like a bacteria, which is what it's supposed to do. So when it starts attacking your body, you can have a lot of joint swelling, pain, a lot of stiffness, and then again, like we said, that irreversible damage, which can cause severe deformities over time. Commonly, it affects the hands and feet, and it typically does spare the back, but otherwise it can pretty much affect any joint in the body. It can occur pretty much at any age. It is more common in women, but certainly does occur in men. One big thing is that smoking can worsen your rheumatoid arthritis too. So that's one of the first discussions I have with people when I first diagnose this, is that you need to quit smoking, because that actually can help not only, other things, but it can certainly help your joint inflammation as well. So we often do x-rays to help diagnose this, and then we do lab testing such as a rheumatoid factor and anti-CCP antibody to help us with the diagnosis. And again, early treatment is recommended because that helps prevent that joint damage. And so again, this is just more pictures of what we see with rheumatoid arthritis, and that picture on the left, again, you can kind of make out that sponginess or swelling of the joints and the knuckles there. And then in the feet, that's another depiction. What we say is the term is cock up toes, meaning there's inflammation there. So you kind of have the joints don't lay flat or go straight. And then you can also get nodules in the knuckles too from rheumatoid arthritis. This is another images of what we can see in the long term from rheumatoid arthritis when it remains untreated. So you can get these kind of, where the fingers become flexed, and then they're unfortunately get stuck like this. So again, early treatment, early diagnosis is key.
That looks very painful. Can you comment on that?
Yeah, it is quite painful. So that's why we like to get people on medications as soon as possible. Because yes, it can be very painful for people. And then this is some x-rays that we show too. And again, this is the more severe forms of it, but just to kind of give you guys a look at what it shows when we check x-rays. So again, here on the left, you can see these joints here. There's supposed to be a nice space in between all of them, and we don't really see that at all. And that's again from long-standing rheumatoid arthritis. And then if you look at this wrist right here, you can kind of compare that to the image on the right side, and you can see there's total loss or destruction of that wrist. And you can't really see any of the bones there. And again, that's from inflammation going on from rheumatoid arthritis. So treatment is something that we call treat to target. So we like to, the target would be what we call remission. So improvement in, we have a lot of handouts or patient scores that we do in terms of how people are feeling and how their labs look. So they're markers for inflammation, for example, and that's how we kind of decide whether there's remission, and their physical exam as well. So that's what we use to kind of decide, oh, do we need more medication? Do we need less medication? Do we need to keep things the same? So what we use typically is something called DMARDs, or disease modifying anti-rheumatic drugs. So some of those are listed there. Methotrexate is our first line therapy. Hydroxychloroquine is another medication that works really well for rheumatoid arthritis. And then a few other medications listed there as well. And those are all pill medications essentially. So then we have the biologic medications, which are a little bit stronger. They all of these medications, unfortunately, carry their own potential side effects. So it's always a discussion that we have to have with patients as to what's going to work best with them, and making sure it aligns with their medical history as well. So again, we have things like Humira, Enbrel, Actemra, and all these other medications, Xeljanz, Rinvoq, are all biologic medications, which again are very helpful for rheumatoid arthritis. We just have to figure out which one's going to work best for each patient. And then psoriatic arthritis is another type of inflammatory arthritis that we treat. And again, that's inflammation, which can affect the tendons, the joints, and then the nails too. So it affects men and women equally, and it can occur in approximately 20 to 25% of patients with psoriasis. So those with psoriasis don't necessarily get arthritis, but some of them certainly can. And usually they get the psoriasis first, and after 7 to 8 years is when we see the joint symptoms start to begin. So we often kind of co-manage this with a dermatologist. So just to give an example of what psoriasis looks like, and really it's that red scaly plaque with the silver scales that you can see on the left. And then you can also get some nail destruction too with psoriasis. So sometimes people aren't quite aware of that as a potential cause, because sometimes that's the only manifestation that people can have for psoriasis. And then these are just a couple more pictures I wanted to show. So in the top left corner, in the nail, we can see these little pits or little holes in the nail, which can happen with psoriatic arthritis. And then this is just swelling of the digit, or something that we call a sausage digit, which is swelling in the tendons and the joint, which cause inflammation and pain related to psoriasis. And then you can see here in the top right corner, there's, obviously this digit is the most what we call telescope. So there's destruction of the joints, and that's from longstanding inflammation. And then the bottom right hand, you can see those psoriatic plaques there on the back of their leg, but also the right ankle is a lot more swollen than the left. So again, just being as a rheumatologist, we got to look at a lot of do the head to toe evaluation to look for what could be going on. And then some of the x-ray findings, you can see what the hand looks like, and then what it looks like under x-ray. And you can see normally there's a nice space in between these joints here, but they're completely fused, and that's from psoriatic arthritis. And then in the top right hand, you can see that those digits have become short, basically, again, from longstanding inflammation. So again, can be very painful, and medications we have to treat them are listed here. So we kind of decide the treatment based on what exactly is going on. Is it skin disease mostly? Is it pain, and is it inflammation in the back, or is it, that sausage digit, or inflammation in the tendons? That's how we decide the medications. And often a lot of these medications overlap with our rheumatoid arthritis treatments as well. Just a brief something about systemic lupus erythematosus, which is the long name for lupus. We have a lot of different ways to classify or diagnose lupus. So there's a whole host of symptoms that you can get from it. And I just wanted to kind of list that there. But you can get arthritis from lupus as well. So this is an example of what we can see with lupus. And you can see that the fingers kind of go sideways there with lupus, which again, doesn't happen for everyone, but it can. And the biggest thing is you can see that with rheumatoid arthritis too, but with lupus, you can push the hands back to normal, just like in this picture. So this, the picture on the left-hand side, it kind of goes to the side, but when you can put it back to normal. But with rheumatoid arthritis, you can't do the same. So again, another important physical exam finding. And then the last kind of arthritis that I was going to go over would be crystalline arthropathy. So that would be something like gout, which is pretty common. It's a form of arthritis, and it's related to something called uric acid. So everyone has uric acid in their body. It's a chemical produced when the body breaks down certain foods. And it can form little crystals in the joints, and your body reacts to those crystals by causing a lot of inflammation, and you can get swelling and pain. It commonly occurs in the big toe, but it can honestly go to any joint. People can have recurrent flares, meaning, for a week or so, they have this really red, hot, swollen joint, and then it goes away for months and maybe comes back or doesn't come back. But over time, once you have those flares happening, it can lead to chronic arthritis, and it can cause actually permanent joint damage. So it's something to definitely be aware of, because over time, we want to prevent that damage from happening. And you can get buildup or tophi, which are, these nodules that can happen on the joints, usually on the elbows, but it can occur in the hands and the feet as well. And that again can cause permanent damage, and is a little bit harder to treat in that it takes a lot longer for your body to get rid of those nodules or tophi. The estimated prevalence is about 3% of the population, and it usually affects men earlier in life than women. And here is an example of, so on the right and the elbow, that nodule there is a tophi. So that's the buildup of that uric acid or gout. And then you can see on the right hand, there's this big circular kind of chunk of bone missing in multiple areas. And that, we call it a rat bite erosion, actually, because it looks like a rat took a chunk out of the bone there. And that's from gout, basically inflammation from that uric acid there. So again, permanent damage that we want to avoid. And then this is what the gout crystals look like under a microscope, because we often take fluid out from an inflamed joint and look at it under a microscope. So we're trying to look for these tiny little needle-shaped crystals, and that helps us confirm that diagnosis of gout. There is also something called pseudogout, which is a little different type of crystal that can be deposited within the joint space. And we look for that as a cause for inflammatory arthritis as well. And that can lead to that swelling and pain as well. So we have to look for different causes of that. And we can often see it on X-ray too, but we can also see it under a microscope too. I don't think I included a picture of it, but it can affect pretty much any joint as well. So it often affects the knees, elbows, shoulders, hips, but then it also can affect some cartilage too. So in the wrists is a very, very common spot. The estimated prevalence is about 4 to 7% of the US population, but it increases with age, and the average age of diagnosis is actually in people's 70s. And so this is just an X-ray example of that. And so in the right-hand side, you can see in the knee joint, that fluffy little white line is actually calcium deposition, the little crystals there from pseudo-gout. And sometimes they can just hang out there, and sometimes your body decides that it's going to cause a lot of inflammation and pain and swelling there. And then again, on the right hand, you can see that fluffy little white lines in the wrist too, which again makes us think that there's probably pseudo-gout going on there. So common treatments that we have for it. So limiting your alcohol intake, low purine diet. So that would be staying away from foods like beer, grain liquors like vodka and whiskey, red meat, lamb, pork, organ meats like liver, kidneys, that kind of thing can certainly flare up gout as well. You want to try to avoid seafood, especially shellfish like shrimp, lobster, mussels, anchovies, and sardines. And then you also want to avoid high fructose products like soda, juices, that kind of thing. Weight loss is recommended because it does help with limiting the amount of uric acid in the body and lowering that rather. And then again, we can see acute flares, meaning short, quick flares where you have a week or so or a few days of this red hot swollen joint. And we usually treat that with NSAIDs or like ibuprofen or those type of medications, a medicine called colchicine, or steroids, whether it's by mouth or we inject it into that particular joint. When we see that it's happened a lot of times and we're concerned that this has now become a chronic process, then we have medications that help lower the uric acid level for gout. And that's a medication like allopurinol. And we do have a really strong medication for gout that helps kind of dissolve those tophi very quickly. But again, that takes a lot of monitoring, and usually that's only after you've failed some of the other medications for it. But we do have a lot of good medications out there for it. Lastly, I just wanted to quickly kind of go over, a lot of people ask what can I do with my diet to help with inflammation. So there are some studies that say an anti-inflammatory diet can be helpful. And so basically it's kind of like a modified Mediterranean diet. So a lot of fruits, vegetables, and a lot of fish is helpful as an anti-inflammatory diet if you feel like that's something that's bothersome, if you're having a lot of inflammatory arthritis. So I do recommend this to patients as something to try, certainly. And some people do tell me that they do feel better when they're on this type of diet. So it's certainly something to keep in mind. And then lastly, I just wanted to give you guys a couple resources for patients. So arthritis.org is the Arthritis Foundation. It has a lot of really good information on exercises, things on diet, and just about arthritis in general. Rheumatology.org is the American College of Rheumatology, has a lot of patient resources out there, again, for osteoarthritis, for rheumatoid arthritis, all the above. And then there's another task, it's associated with the American College of Rheumatology. It's called simpletasks.org, and it again has a lot of patient resources for arthritis out there. These are my references, and I just wanted to say thank you. I welcome all patients who have joint or muscle pain and weakness, because an early evaluation, again, means earlier treatment and a better quality of life. And these are the offices that I'm located at. And if anyone has any questions.
How do you treat the pain? What do you use to treat the pain? I'm sure it's different from patient to patient and diagnosis to diagnosis, but what are the most common ways to treat the pain? And I'm sorry I'm so focused on that, but it just seems like a lot of these patients must be in pain all the time.
Yeah, certainly. So we have a lot of different medications. And again, it does quite vary based on the type of arthritis it is. So if it's osteoarthritis, then the regular, physical therapy is helpful. Over time, it is helpful to build up the muscles and bones or muscles around the joints. Certainly medications like NSAIDs, ibuprofen type of medications are helpful. Tylenol, again, we have to use all of these with assessment of what their other medical conditions are. There are medications that are helpful for chronic pain, such as gabapentin, or things like Cymbalta or duloxetine, which actually were, initially marketed as an antidepressant, actually have been shown to be helpful for chronic pain as well. So just a big discussion with your primary care doctor or your rheumatologist about these medications. And then for the inflammatory types of arthritis, like rheumatoid, all those medications that I listed, those DMARD medications or the biologic medications, are really helpful for pain in the long run, because it reduces the inflammation going on, and that therefore helps the pain.
Thank you.
Yeah.
I really appreciate your information on gout, because unfortunately I met the Gouts when I was about 51. They're not nice people.
No, they're not.
But it is, a lot of what you touched on, my doctor said too. I love red meat, like, and now I have to be extremely careful, because even just a little bit of red meat, if I it won't hurt this time. Within a couple of days, just a tiny little bit, and I'm having a bad time. So it's not at all fun. And, I'm not at all a drinker. So, that's not an issue. I don't dig fish. I'm not a seafood person, but I seem to do okay with fairly lean poultry. That seems to be all right. But and all those seafood items you did list are the ones that I do like. So no more shrimp, no more. So it's not fun, but when you've been a red meat eater all your life, but it's a heck of a lot better than. I remember the first time I woke up, and it settled very first in my left heel, which the doc said, it's not. We'll check it out. That's usually not where it goes. But like you said, it can pretty much go anywhere, but left heel is where now it's into my toes as well. But man, it was kind of sore. I got out of bed and stood and like instantly fell. It hurt. Like I could barely stand up. I'm like, something's going on with my friggin' leg and my foot. And got there and they did the test, and he's like, yeah, you got the Gouts. Nasty people. Don't care for them at all.
Yeah.
I really, really appreciate your information on that. Thank you.
Thank you, Dr. Kannan.
Sure.
So Jeff, do you have any comments
for you? So say for instance, like you're doing yard work and, over the weekend, and 10 years ago on Monday morning, you'd feel fine. Now, Monday morning, you're sore for a couple days. Is that kind of a precursor for what could be coming on, or is it just kind of the aging process?
That probably sounds to me more like aging process. And then maybe like a little bit of deconditioning in the back muscles too. So you want to make sure that you're trying to keep the strength in the back muscles and the core muscles too.
That's good news.
And then also with some of these, I forgot all the different terms you use, but can somebody have multiple symptoms or multiple conditions?
Okay. Yes, people can have multiple types of arthritis. Often people do have osteoarthritis, the wear and tear kind of arthritis, and an inflammatory arthritis on top of that. So you kind of have to be evaluating that both with your doctor.
Okay.
Yeah, and sometimes people can have, gout on top of that too. So always an evaluation.
Well, I don't have any more questions myself, and thank you so much for this.
Thank you, Dr. Kannan.
Thank you for having me.
If we get any questions after we post, we'll send them over your way and get them answered.
Sounds great.
Absolutely. And I'm going to go
Thank you,
ahead and
Jeff. Nice to